Hello all, this is Dr. Dheeraj Matsapu. I'm a senior consultant in the field of neuroanesthesiology, and this video is about the impact of increasing the medical seats in India and how it is going to create a very big problem in future. Okay, we're not talking about saturation or demand supply or anything which we usually talk in our videos. So what I'm going to tell is, so why government is increasing seats or why why they're getting permissions to increase seats is they're thinking that if they increase the seats, then more and more doctors would go to tier 4 cities and tier 4 cities, the towns and villages to serve. So that is where the deficit is there, right? That is where actually scarcity is there. Many doctors are actually not going to towns, and you must be knowing that. So, but at the same time, by increasing these seats to 60,000, 70,000, I mean the postgraduate seats, so you're introducing another very big problem. I'll try to explain that in a very simple way. So what happens is, in the ancient times, okay, ancient is what I mean about 30, 40 years back, there were very few training centers and they used to produce very, very less seats. Okay, so what used to happen is, in the people who are produced, in the postgraduates, around 10 to 20% of the postgraduates were not trained properly. Around 70 to 80% of the postgraduates were trained up to the mark. The reason is very good mentors, very few training centers, good patient load. Right now, you all agree to what I'm saying. Now the situation is, the government has increased the seats, but where did the predominant increase happen? The increase mainly happened in the smaller hospitals and newer hospitals where the training and the caseload is not adequate. So what the current scenario is, 40 to 50% of the training centers will produce students who are not up to the mark. Okay, doctor, everyone is a doctor, but the thing is, like, if you are not able to solve the problem of a particular patient, then I feel that is one part of the problem. Okay, so then this is called as a quantitative gap. I'll try to explain. So the high volume centers, like bigger institutes and all that, would expose the students to complex cases, and the skills would be superior. But at the same time, the increase happened where the increase of the institutes in thousands and thousands of seats actually happened in smaller and newer hospitals. So there, the complexity of case wouldn't be there. One small hernia or one small other cases they would be doing. So the students actually come out without much exposure to the complex cases. So that will lead to production of the postgraduate student without much exposure to adequate skills. Okay, this is one of the problem which will be created by increasing the number of seats. This many of you know actually. So you can actually also would not be exposed. The second actual problem is the passion to teach has come down now. So when I interact with teachers in different institutes, I don't call everyone, but 90% of the people are not actually passionate to teach, which was there in the ancient times. Around 30 to 40 years back, what used to happen is teachers were passionate. They were very good teachers. And now actually everyone talks about investment, everyone talks about finances, and I know finances are very important, but a person who is in the teaching field should have a passion in teaching. See, you might tell that, Dheeraj, you are in a corporate hospital earning money and then you're telling us to teach. See, I understand totally. So if I am in a teaching hospital, I would have somehow developed some kind of passion towards teaching. And I will tell a solution also. In the solutions part of this video, I'll tell you how to actually improve this passion for teaching in the people who are actually in the academic area. So that has significantly come down now, and that is producing students, even the case volume and load is good, they are coming out without much bedside teaching. So I feel that is another important aspect which as a country we are losing. So that also needs to be improved. So these two problems together, over a period of 10 to 15 years down the line, is going to compound. Okay, compounding interest rate, how your money compounds. The same way, this also will compound, and over a period of time, 60 to 70% of the doctors who are going to come out, and by 2040, 60 to 70% of the doctors would not have enough skills and suboptimal training, and they wouldn't have the capacity to treat the patients. Okay, patient outcomes would significantly suffer if this trend continues. Okay, then what is the solution there? Now you introduce the problem. What is the solution? The solution part I'm coming to. The solution part is, see, the guidelines to give permission to the hospital should be damn strict. And what I feel is, if case complexity should be seen and not the number alone, and more scrutiny should be there when you are actually allotting seats in postgraduate colleges. So then if you tell me, see, a lakh MBBS people are coming, and then now if you decrease the PG seats according to your video, then how will the MBBS students get into post graduations? See, our intention is not to give seat to every person. Our intention is that have a very quality education in the country, so that the doctor who's coming out of that specialty should have that particular skill. Okay, or you have to later on work in a place where that kind of work is going on. But do everyone get opportunity to work in centers where complex work is going on? No. So again, if 60 to 70% of Indian doctors are not trained, then even centers like ours and big centers, even if they try to train them after post graduation, only 20 to 30% you might train, but finally 30 to 40% of people would not be trained in future. So this is what I feel. You cannot keep increasing the postgraduate seats. The only solution is, rather, I don't call decrease, at least you have to stop here and increase the quality of education there. And the second solution what I would offer is rotation. Peripheral postings are there now, but not that kind of a peripheral posting where student actually goes to a center, just chills around for 1 month there. It's like a vacation for most of them. That is not the peripheral posting. The peripheral posting is, you need to have a 6-month modules. For example, a person who's studying in a government hospital should come to a center like mine, a corporate hospital, and a corporate hospital DNB should go to a government center. So for 6 months. So that kind of rotation should happen, and proper training rotations like how they do in UK. UK training, if you undergo every 6 months, you actually rotate in a center. You should be signed off in that particular center, and then you will be eligible for your specialty exam. So in the same way, we should also start such kind of rotation. And then what happens is, there will be some kind of uniformity in our education system. Not studying in one place and just gaining skills of that same place. That wouldn't work out. Okay, then the third, mentorship problem. Mentorship problem can be solved by giving incentives to the faculty. So what happens is, if somebody is mentoring students, if somebody is actually doing good bedside teaching, there need to be some kind of incentive, right? With the same salary, if you tell somebody, nobody will get interest. You have to pay extra money to the person who is actually showing interest in educating people. If you give some 3,000, 5,000 rupees, nobody would get interest. The amount that the assistant professor is getting should be equal to amount that a corporate. The interest will come when the person is getting good salary and good package, and if he feels that even he is compensated enough. And it's all about comparison, right? They will be comparing with their peers in some other hospital. They will always feel that, that fellow is getting some X salary, I'm getting only X by 4 or X by 5. Why should I actually work like them? I will just go do some time pass there, have 3-4 coffees, and I'll go back. That is what they would think. So what I feel is, you need to actually give enough money, at least near to the people who are getting near to the salary of what a corporate consultant gets, to a person working in academic places, and then the quality of education will improve. If you are not able to give that kind of salaries, then I think we cannot improve the education in this country, because nobody will be intrinsically motivated to train people. Okay, understand this. Next, last is the simulation. This anybody can tell. Simulation is the way, even that we are lacking. In Bangalore, I think 1 or 2 places have simulation labs. Every center, if you're applying for a postgraduate seat, you should have your own simulation lab. Without that, you shouldn't get permission, is what I feel. So these are the minimum things that we need to do. And if we are not doing these changes in our education system, then we will get into a very big problem in future. And what happens is, if once I get told, I don't want to get treated by a doctor who is not skilled. Okay, I'm telling you openly. See, the letter doctor, everyone is a doctor, but doesn't mean that everyone has equal skills. So that is the problem I'm talking about. Hope you understood. And so I request you guys For example, if you're working, then some of my subscribers would be feeling that if you're working in a smaller hospital, then what should we do? So what you should do is, since all these changes won't happen immediately, what you have to do is, please, 3 to 5 years, follow my other videos. I always tell a stepwise strategy, because I always assume that you're not trained properly in your post-graduation. Okay, so in my step 1, I always tell in growth, change your mindset. Step 2 is all about my apprenticeship under a solid person. And step 3 is about personal branding. And step 4 is going abroad for training again. Or going into a bigger roles, or venturing into some kind of management, leadership, and all that. So these are the steps to grow in any kind of a career, irrespective of the specialty that you are in. So what I feel is you need to work in a very good place. At least now it is possible to work, but in future, 5 to 10 years down the line, even after post-graduation, to get into a good center will become very competitive. That is how the future is going to be. Okay, every line what I told in this video is very, very, very important. If you come to this part of the video, then you will succeed surely, because I know you are very much passionate. That is why you come to the end of the video. You will succeed surely. Don't worry about your career. Bye bye.